Nearly 2 years into the pandemic, we've all heard the advice by now. Getting vaccinated is the best way to protect yourself and others. But when it comes to vaccine for the kids, a lot of folks still have concerns and hesitations. Thank you for joining us tonight as we get the facts from the doctors and health experts and answer some of the questions that parents have about the vaccine. Let me introduce our panelists. State epidemiologist for the Department of Health, Dr. Sarah Kemble. Chief of Infectious Disease at Kaiser Permanente Hawaii, Dr. Tarquin Collis. Dr. Joy Dalman, a Kaiser pediatrician. And Dara Kauhane of Project Vision Hawaii. We thank all of you for being with us. Well, let's start by going over the vaccination rate overall. Where are we as a state, and how many of our kids ages 5 to 11 have received those initial doses since the vaccine was given approval for that age range? Dr. Kemble?
Yes, so as of today, we are tracking 22% of our children aged 5 to 11 in the state having initiated COVID-19 vaccine and 9% completing their vaccine series. This shows us with an edge over national numbers, which show about 17% of children in this age group having initiated vaccine as of this time.
Thank you. Now, as we monitor the latest variant of Omicron, does that change anything for our kids and vaccination? Should they get vaccinated now or wait to see if the vaccine changes to better tackle the new variants? Dr. Collis?
Yeah, hey, I would say, there's a lot we obviously don't know yet about this variant. It's only been really, the flag was raised about, a week and a half ago or so, but I think the early signals are that it may be more transmissible than Delta, which is hard to imagine. Actually, Delta was so transmissible, but that's the early signal we're seeing out of South Africa. We do know that it's clearly in Hawaii. Clearly, we've had 3 cases described here. Sarah knows most about those, but my understanding is none of them were travel related. So it's likely already circulating here. There's going to be a lot of testing underway, a lot of research ongoing, both on the epidemiologic front and in terms of lab work to figure out how our current vaccine does or doesn't protect against Omicron. But we have a lot of experience with this vaccine and with others, with other variants, Alpha, Beta, Gamma, and Delta, which share a lot of the same mutations that Omicron does. And we know well that even when vaccines prevent variably against protection, they prevent really well and consistently against severe infection and death. And that's really the point of vaccine. And we expect that'll be the case with our current vaccine and Omicron. I think what's important to understand is that it takes really months to figure out if a vaccine needs to be tweaked, and then months to reformat a vaccine and get it approved and safely produced. And so really, please don't wait, I think, is an important message for folks. Don't wait assuming that we'll have a better vaccine soon, because I think that's a long ways down the pike, and you want to bring yourself and your kids to safety quite quickly.
That's right. Better something now than wait for later. Dr. Kemble, do you concur with that or would like to add to that? Wait or get it now and follow up with boosters if necessary?
I agree. Don't wait. Right now, the currently available COVID-19 vaccine is the best way to protect yourself, your family, and the community.
Thank you. Now, what can you say to parents about the research that went into this vaccine amid the perception among some that it was rushed or isn't safe for young people? Dr. Collis.
Yeah, I think what a lot of people don't realize is that mRNA vaccine research goes back quite a few decades, actually. I was actually at University of Pennsylvania during residency when Katie Karako was there. She's a Hungarian researcher. She's now, I think, executive vice president at Pfizer. But back then, she was already working on mRNA vaccines, and they were worked on at UPenn, at University of Wisconsin, at Duke for a long, long time. We just really, actually, I feel like got incredibly lucky that they came to fruition right as this pandemic was hitting. But we've been looking at these vaccines for other infections as well, flu, rabies, Zika, cytomegalovirus, as well as for cancer. So there's been a ton of research on the mRNA front. And then really quite aside from the research coming to fruition during the pandemic, I would say that we now have the benefit of them having been out for quite a while. I mean, the Pfizer vaccine has been in widespread use for well over a year now. And it's been fully FDA approved for those 16 and up since the late summer, since August. So hundreds of millions of doses, quite aside from the research that preceded it. We have a lot of real-life expertise with this vaccine, and it's really been quite remarkable.
And thank you. Dr. Campbell, what can you add to that, too, to counter that perception of a rush to a vaccine or safety for young people?
Right, I would just echo that it's been a historic focus of resources globally to get this vaccine through all of the standard steps for testing vaccines and getting it approved. So it's not that steps were skipped, but really a global effort to make this happen, and really a scientific historic moment. I would also point out that over 5 million children aged 5 to 11 in the U.S., nearly 5 million children in the U.S. have now been vaccinated with the Pfizer vaccine, and we're seeing a good safety profile thus far. And also keep in mind, over 15 million adolescents aged 12 to 17 have received their doses as well. So it's not like we don't have a lot of information at this point about safety for the vaccines.
Thank you. Well, what about the side effects and the unknowns for the long term for the vaccine? And also, what are the risks for kids if they don't get the vaccine, but they get COVID? Dr. Dahlman.
Yeah, so actually for side effects, kids are doing great. You know, I have two boys, they're 8 and 10. They just got their second shots last week and surprisingly had no complaints afterwards. Went back to school, were just fine. And that's what I'm hearing from my patients as well. Kids, thankfully, are having a lot fewer side effects than adults did. And we see sore arms, that's the most common thing, maybe some body aches or low-grade fevers for a day, but that's the lesser common than in adults or older teens. And then I think, for that question of what about getting COVID versus the vaccine, we do know that COVID is a risk for kids too. And we think about them being a lot safer than adults, but they can get sick, they can end up in the hospital, and unfortunately some children have died across the country. So getting this vaccine can help protect them from a serious disease as well.
Thank you. And Dr. Collis, can you also speak to that? People think about what if there are unknowns down the road, but also there's knowns presently by getting COVID and possibly some unknowns down the road if you've carried the disease of COVID.
Yeah, I mean, there's so many important points there. I think that a couple of points I'd add. In general, vaccines typically don't cause long-term side effects. Maurice Hilleman, who is really the father of modern vaccinology, he personally developed about 8 of the 14 childhood vaccines that we use now. He worked at Merck for decades. His rule of thumb was that you breathe the first sigh of relief when a few million doses are out there. And in general, almost all vaccine side effects are seen and then resolved by 3 to 6 weeks. So we don't anticipate actually seeing that much going forward that we don't already know about with these vaccines having been out about a year already. I think just to echo something that was said earlier was that these vaccines have to be weighed against the risks of COVID itself. And although it's true that most kids with COVID do well, COVID's now among the top 10 causes of death in the U.S. among children. It's number 6 and climbing. And about a quarter of the cases that we're currently seeing of COVID in the United States are among children. So it's both very common, and once in a while it can cause severe debility and death. Quite aside from ending up in the hospital, long COVID is something that we're really seeing a good number of children struggle with, and there's various estimates as to how frequent that is, but it may be as common in 1 in 5 children having long-term symptoms from COVID that seem to last weeks and sometimes months, and these can be headaches or brain fog or fatigue or joint discomfort, and sometimes anxiety, even depression. So quite aside from things that end up hospitalizing you, it can really affect your sports and your school and your relationships, and these are all eminently avoidable. I would also put in context that pretty much all the vaccines that we use for kids, with very few exceptions, chickenpox, flu, whooping cough, these are all for infections that are generally mild but occasionally really severe. And that's what we're really trying to prevent, is to give you a safety buffer in case you're unlucky enough to be one of the kids with COVID that really has a rough time with it. And that's the main point of the vaccines, and it joins a host of other vaccines that have had excellent success on that same front.
Wow, doctor, thank you. And just to emphasize something the doctor just said, some say an almost 1 in 5 risk of long COVID among kids, and long COVID can be debilitating and much more of an unknown than a risk of vaccination. Thank you. We also wanted to hear directly from kids and parents about their experience and decision when it comes to the vaccine. The After School Alliance put us in touch with some families who spoke about why they decided to vaccinate.
Getting vaccinated was a very important thing for me because not only did I think that I'm personally very passionate about public health, and so I understand that getting vaccinated would mean I'm protecting the people around me, and so I was very passionate about that. But more so, I just really wanted to hang out with people and just go out to the mall and do things that you would be able to do in a post-pandemic world, right? And so that was one of my biggest motivations.
I wanted to get vaccinated because I wanted to protect me and my family so we don't get COVID. Once I heard the vaccine was out, I kept begging my mom every day, so she finally said yes.
We had a conversation with his physician at his physical and felt that because he plays sports and wants to get back out there, that it was the right decision for him to get it as soon as possible. The entire family was vaccinated and the side effects were mild. There were side effects, but not anything compared to what COVID might have looked like.
I wanted to keep everybody safe, and after I get my last dose, I can finally go traveling and see my friends.
I would say that getting vaccinated is the best decision for not only yourself and your own health, but also the people around you.
Well, mahalo to those young folks for their eloquence and their decision. Well, what suggestions do you have for parents in talking to their kids about the vaccine? How do you handle it if the child wants it but the parents don't? Dr. Dahlman.
Yes, I really enjoyed hearing from those kids. And I think it highlights to me just how kids are really ready to talk about this. They have the ability to understand a lot of these things. So what I talk to parents about is talk to them about it as a medicine. You know, we take a lot of different medicines to help us get better. Well, this is a medicine to help us not get sick. You know, it goes into your body. It helps turn on the whole system of protection. So when you meet COVID, you have some safety from it. You're protected from getting sick. And I think you're treating it like any of the other shots that we give, like the tetanus shot. You know, we're pretty comfortable getting our tetanus shot each, when it's due, and encouraging families to consider it in that category. I think for those families where the children are really interested and the parents are hesitant, I try to get them talking to each other in the room. I try to start that conversation of what are your concerns? You know, what are you worried about? And to the child, what do you want to gain from this? You know, like those children were saying, getting back to school, getting back to activities, sports. I think just starting that conversation often really helps. And then encouraging families to talk to people they know who've gotten the vaccine. You know, ask those questions. It's good to ask questions. Talk to your doctor, look up good information. You know, healthychildren.org is a great website run by the American Academy of Pediatrics that has a lot of questions and answers for parents as a good source. But talking to people they know who've gotten the vaccine is often a great first step.
Thank you. And Dara, what can you add to that too? Whether it's parents having the conversation with the kids that they'd like them to do this, or if a kid has to talk their parents into it.
Being one of the providers out in the field, I'd love to share a story of one family who I think did a really great job of having that conversation and making that decision together. We had a young boy who had just qualified for the 5 to 11-year-old vaccine. And he came to us very excited to tell us that he had been, just like you saw in the video, begging his parents to get the vaccination. And it's because he had two instances that he went through. One, he wasn't able to see his tutu for the longest time last year because she, as he said, is already very sick and I didn't want to get her sicker. And so he missed being able to go over to his grandparents' house. And then we had another instance where his class, they had to stay home because someone in his classroom, once they started school again, tested positive. And so he said that he really wanted to get vaccinated so that he could protect, of course, his grandparents, his family as a whole, but also his classroom. And he was really excited to go back to playing baseball. So really loved that, he saw that as his kuleana to help take care of those around him. And we also have, for those children who are interested and maybe their parents aren't ready for it yet, we've been working with our partners at Keiki Heroes, and they have these wonderful coloring books and comic books. They're in different languages, like this one in Chuukese, that they can take home to their parents and tell them what they've learned, and again have that conversation as a family.
That's great. And Dara, tell us where you're distributing those kinds of materials and such. How are you getting that outreach out to the kids and the families in those communities?
Yeah, these have been dispersed throughout Department of Education. A lot of the kids groups like Boys and Girls Clubs, HCAP, for example. We've had them at all of our events, our community events, where we take the vaccine out into communities, out to the public housing. And, you know, of course, every time that we are at the Department of Education schools and public charter schools, we've had them as well. So the kids love to color during their observation period. And of course, if they can have these ahead of time to have that conversation with their family, that would be the best.
All right, great. So parents, if you've seen those come home, that's where they came from. Well, we have a pause now for a short break, and we'll be back in a moment with more questions.
What I love about working at Kaiser Permanente is our approach to caring for our patients.
Our healthcare teams and systems are in place to support patients and achieve better outcomes.
Members have an incredible choice of physicians. It's inspiring to see our care team come together for our patients.
Here it's like Ohana, and I think our patients can feel that.
That's how healthcare should be. I can't imagine doing it any other way.
Well, welcome back. We want to know more about what's being done in the community to improve access to the vaccines for the kids. Before the break, we were talking with Dara from Project Vision about what they've been involved in the schools. We'd like to hear more about how Project Vision got involved with the vaccination efforts. Dara.
So Project Vision Hawaii is an organization that's based in ophthalmology and optometry, hence our name with Vision. But during the pandemic, we couldn't get into the schools to do those vision screenings. And so our Vision team turned into a COVID team. And we're really grateful for the partnership and the guidance of the Department of Health that made that possible. We've always focused on our houseless community, on those in public housing, our minority populations. And so this was a great opportunity to provide COVID services to those groups as well. We've also expanded into providing services into the jails and prisons. But, you know, over the last year, working with the Department of Health and with our partners at Kaiser Foundation, Papaololokahi, HCAP, we've created these events to be family friendly. We knew that, you know, at some point the keiki vaccines would be made available, and we wanted kids to feel comfortable coming to our events. And so we have music, we have a DJ there that, you know, plays local tunes, and we have an MC who everybody can recognize, and who, you know, incorporates games during the waiting period, or while they're waiting in line to get to their shot, or while they're doing their observation. We have little games or TikTok challenges, and it's really created an environment where the kids feel comfortable.
All right, well done. Sounds like a good time for a good cause. Well, how can doctors and parents work together to calm any fears? Dr. Dahlman.
I think the first part of that is just trying to have a conversation, you know, trying to find out what it is that that the child or the parent is concerned about, and answering that question. Often it surprises me, you know, what people's concerns are exactly. If it's a story they've heard from a friend that raised some fears, or if it's something they read online. You know, so trying to find a way to hear what those questions are, answer them thoughtfully, and recognize that it's normal to have these fears. And it's been a long time with a lot of unknowns, a lot of information coming out constantly. It's a lot to absorb. And I think just being ready to have those conversations whenever they come up, you know, at home or at work or in the grocery store.
Thank you. And Dr. Kemble, can you add to that? I know Department of Health has been constant in the outreach to the whole community. Now we have the kids in particular. How can the doctors and parents work together to calm kids' fears?
Yeah, I agree with a lot of what Dr. Dahlman said, and just adding to that, that it's also about setting expectations together so parents can tell their kids, as Dr. Dahlman was saying earlier, the experience is going to be really just like the other shots that you got for your childhood shots. Kids have all received childhood shots and would be familiar with that experience. And also, when they get there, the doctors can help by just letting the kids know briefly what's going to happen, what to expect, and really not making a big deal out of it, because it really is just like most childhood shot experiences.
Excellent. So if a child already had COVID-19, do they still need to get vaccinated? Dr. Dahlman.
Yeah, the answer is yes. So having had COVID-19, you do get some protection from future infections, but not enough. The vaccine really boosts that immunity. It reminds your body what that virus looks like. So the next time you see it, you have a stronger, more rapid response. And what we've seen with the vaccine is it actually expands your body's ability to respond to the variants. We see these new types of COVID virus coming out, and the vaccine can really help you have that protection from those new varieties, and not just from the one infection that you got. So yes, even if you had COVID infection, we do recommend getting that vaccine.
And how long would they wait after an infection to get the vaccine?
So basically, once your isolation period is over and your symptoms are improving, you can get the vaccine. So typically that's 10 days from the onset. As long as your symptoms are getting better, you can get that vaccine on that 11th day potentially.
All right. Well, how are the efforts going to get more vaccination sites at schools and to ramp up the COVID testing in schools? Both of those can be a challenge, especially in the rural communities. Dr. Kemble.
One approach is to do vaccines on school campuses or in coordination with schools, if not on the campus itself. This is a familiar location and a trusted location for many kids and their families. So that's been an ongoing effort with many of our providers and schools throughout the state. As of now, we have completed 145 school vaccine clinics for first doses and 43 for second doses. And we're more than halfway through that effort to offer those vaccines on school campuses. We're really also working through providers to make sure that vaccines are available even for those who are not going to go on school campus to get it.
Excellent. And how about the testing, Dr. Kemble, while we have you? Is the testing ongoing?
Yeah. The testing is going to remain incredibly important, especially as we hear about new variants like Omicron. So that's another major effort that has been a collaboration between the Department of Health and our schools, both Department of Education and many of our independent schools and charters as well. We now have all of the DOE schools registered for school testing programs. And in any given week, well over 100 schools are doing that testing. And we continue to work with schools and communities to increase consent to participate in those programs, because you do have to sign a form before your kid's going to be able to get tested in school. So just a reminder that this can be a great way to keep tabs on status for your family, for your kid and their schoolmates and their sports mates. And it's a great way to get that information done really easily without too much effort of having to go to a provider.
Excellent. Dr. Collis, Kaiser's been involved, whether it's with some public but also private schools and outreach to those kinds of settings. Tell us more about Kaiser's role with the schools in particular.
That's been pretty neat. We've engaged with schools really throughout the pandemic. As soon as the pediatric vaccinations came on board, I think we have something like 21 elementary schools scheduled or on the schedule already between now and January, with those vaccines mostly being delivered on site. Some of those are ones that the DOH has asked for our help with. Others are principals that we've worked with, for the 12 and ups when that was approved back in May. It's been pretty neat. I was talking with some of the vaccine teams last night, and a couple of their observations were that the ones that are done during school hours when the parents aren't there seem to go the best. Kids are often a lot braver and have a lot of fun with their peers as they go through this kind of thing. And the schools have done a great job of making it fun. A lot of them are playing movies or music, and there's just a lot less drama. So I think as a parent, if you have a child who has the chance to get their vaccine at school among their buddies and you don't have to bring them to their pediatrician to do it, I would take them up all day on that, because it's been a good experience for the kids, and that's awesome.
Sure. And Dara, you were mentioning Project Vision has seen that kind of success at schools. Anything else you want to add on that?
Absolutely. We've been, working with Kaiser and Queens and HPH and others to bring testing to each of the events so that both are offered, so that families can make use of those testing or vaccination efforts at any of the community events that are put on. But like everyone else has said, we've been trying to add in fun activities. We have balloon animals, for example, there that HCAP has provided. Hawaii Fido and Canine Therapets have brought in service dogs to help kids ease their fears, before they get the shot, and to play with them after. We're just trying to make it as fun as possible with our Minion Band-Aids, Paw Patrol Band-Aids, and stickers, whatever we can do to promote the kids to get their vaccination, have a fun time while they're there, and spread the word that it's not so bad. We want them to get vaccinated and help protect our community and have fun while they're doing so.
That's great. Well, we're almost out of time. Let's end with your final message to parents and kids who are still considering the vaccine. Dr. Kimball.
I would say don't wait. Get your shot today for your kids and for yourself if you haven't gone yet. It's really the best way to protect your keiki, their siblings, your family, their school and sports mates, and the whole community.
I wanted to add that we have, multiple events available throughout the community, something that if you don't want to get it done at school, something closer to home, at the public housing, like I mentioned before, or at different community events throughout the state. And we even do in-home vaccinations in partnership with the Department of Health. So if that's something that your child needs, please make sure to make use of that as well.
I would say if you have questions, still ask your doctor. We're here to help. No question is too simple or unusual. So ask questions, talk to people who've gotten vaccinated. Get out there. Let's get our families protected so we can get back to a healthy school year after the holidays and time together with all the good sports and activity that kids need and all that social time.
Yeah, I tell parents this is not that different than deciding to put a child in a car seat or a seatbelt when they're traveling. What you're trying to do here is really, most trips to the store or drives on the freeway are benign, and if you do get into a fender bender, they're nothing bad. But the majority of the time, you're definitely going to want a seatbelt if your number comes up and it's a really severe crash. And the same is true for infections. Vaccinations play a crucial role in helping keep you from, from a dangerous situation that you can really prevent. And so I think all parents care a lot about their kids. And when you're in a pandemic, it's never a question of, how long do I wait? It's really should be a question of when do I know enough to make a smart decision for my kid and for my family? And I think we know plenty at this point to go ahead and get our kids to safety.
Well, thank you so much. And that's all we have time for tonight. We thank you, panelists, for participating and sharing your knowledge and your expertise and your compassion. Time now for a quick message from our sponsor.
Aloha! On behalf of Kaiser Permanente Hawaii, we're honored to be part of this program to help parents learn more about the safety and efficacy of the COVID-19 vaccine for keiki.
Our care teams have been battling the pandemic for nearly 2 years now. They're tired, but they're also hopeful. Hopeful that with vaccination, we have the answer to end the suffering and sickness. An answer to bring all of us back to some kind of normal soon.
So thank you for tuning in to learn more about how you can protect your keiki. Hawaii is a special place where we look out for each other and help our neighbors. Getting vaccinated protects your child, your family, and your whole community.
As a father and a physician, I've vaccinated my kids against COVID-19. We hope you enjoy the program, and please share the information you learned with your friends and family.
We're all in this together. Mahalo.
Take care and aloha.
And thank you so much to our sponsor, and thank you at home for watching. Stay with KHON2 and KHON2.com for the very latest on the COVID-19 pandemic and the vaccine. Mahalo and good night.
This presentation of Protecting Our Keiki is proudly brought to you by Kaiser Permanente. Thrive.
I think I know what's going on.
This presentation of Protecting Our Keiki has been proudly brought to you by Kaiser Permanente. Thrive.
This holiday at Aloha Kia, we'll be selling cars, but we're also not forgetting about our community in need. Beanie, tell them about all the organizations we'll be donating to.
Right! Hawaii Food Bank, Salvation Army, and Lau Lima.
Feed the Soul. Bring in a few cans of food to fill up our new Kia Soul at any location island-wide. You too can help your local food bank.
There's so much to be thankful for.
Happy holidays from all of us at Aloha Kia. It's Kia's Command a Season sales event. Reserve a new Kia today with Aloha Kia's Express purchase. And remember, you know a guy.
Parents want to protect their kids from COVID-19, but some have questions about the vaccine. How is it different from the adult dose? Are there any side effects? Protecting Our Keiki takes a closer look at the COVID vaccine for children. Doctors and health officials break down the facts, and we'll talk with kids and parents about why they made the choice to vaccinate. Protecting Our Keiki tonight at 7:30 p.m. on K-High and 9:30 p.m. on KHON2.
Sponsored by Kaiser Permanente. Thrive.